with introductions?
Yes.
Okay, we'll go ahead and start. Do we have anybody on the phone?
Well, then we get to start with Will.
Okay.
Okay, Cal, Lake County School District number 7.
I'm Susan Campbell, recently married, so my name's changing to Pointier, so you'll see me now as Susan Pointier. And also, I'm transitioning from Lake Health Clinic over to the business office as the new revenue cycle manager, so I'm making a little bit of a role change.
Arvinder Singh, Chip Coordinator, Lake Health District, Lake County.
Brooke Kelleher with Food Court.
Diane Clay with the Lake County Food Jar.
And Casbon, Lake County Senior Center.
James Williams, Lake County Commissioner.
Leanne Davis, Lake County Youth Mentor Program.
Kristen Hill, Patient Navigator, Lake Health District.
Charlie Twig, District CEO.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Look at you.
Garrett Shaw, Lake County Examiner. Just the guy that sits in the back.
Christy Albertson, I'm the Grant Writing Coordinator for the Health District.
Judy Clark, Director of Public Health. Alana Shamulak, Eastern Oregon Health Division Alliance.
Rod Harwood, Older Adult Behavioral Health Specialist with Greater Oregon Behavioral Health Incorporated.
Did anybody join us on the phone? Anything? Okay, so our February minutes are unavailable, so we'll review those at the April 11th meeting. So from there, we'll start with Paul.
Well, on the agenda it says the incentive measure guide. I saw you having it up, Arvinder, real quickly. Just want to make sure you guys know that this is available. This was 2 documents, but it's now 1. And included in this are the definitions of each of the incentive measures, what population is subject to that, and then what codes a clinic or health system must bill in order to get credit for doing that. And then if you scroll down a little bit, Arvinder, there's at the bottom of each individual one, there are some strategies, suggested strategies. So on the adolescent welfare visits, right there, you know, strategies for improvement. So it's just a resource that I told our vendor not to print out. It's about 19 pages, but you know, every meeting we have, somebody asks a question about, well, what age is that and who this. So that's what that tool is about. That's it. Okay. Just make sure that we distribute that. And then,
It's there in the packet.
Right. So the other thing is we shared the qualitative, quantitative assessments. We triangulated that last meeting, shared the data that we have here, and we need to pick, you know, 4 to 6 areas for the Lake Community Health Plan to update for finishing by June. So just we've been having open discussions on other things, and people argue based on big headings and where you've been in the past.
So do you want us to select them right now? Or?
Yeah.
Okay. And they're all listed on the document.
Yeah, these are potential areas, sure. Yeah, you can't do them all, I can assure you that.
You sent out a survey about that already. Did everyone?
No, that's
a
different
different
from. So should we ask everyone to vote for the one they want, and they can leave the document on the table? I can collect it after the meeting.
Any method works, but
okay.
You know.
Yeah, if everyone's fine with doing that, we can do that.
Yeah, so choose 1, choose 2, choose like number them. What's?
Yeah, I mean, if you're going to do that, then you do need to weight your answer, WEIGHT, so that your most important one, you should put a 3 next to, your second most important a 2, your third most important a 1. Opposite, right? So that you can add them up together.
And these are for voting members, correct?
All members, community, whoever.
Is this big headings or?
It could be subheadings too.
So, for example, Those of you, if we can all go to the third page that says obesity, chronic disease management. Underneath that says mental health, and at the bottom it says early childhood, right? Everybody got that page?
Yeah.
So what you would be doing is if you think chronic or obesity, chronic disease management is the area that we ought to target, you would put either a 3, 2, or 1 to the left of that. And the same thing with mental health, whether it is focusing, is that correct? That's
Yes.
how we would do this.
Right, but on the, if you turn the page, there's more, right?
Yes, as you keep turning the pages, then there's, at the bottom it says early childhood, and that description is on the 4th page. Then there's social determinants of health, again, 3, 2, or 1. And the last page has substance use, senior health, and incentive measures. So those would be the 7 or 8 items, 1, 2, 3, 4, 5, 6, 7 items that you would place either a 3, a 2, or a 1 that you think we ought to be spending our energy in the next year aside from these incentive measures.
That was my question, things that this group could conceivably impact.
Yes.
Okay.
That's our intent.
Okay.
Is that?
Question on that.
Oh, yeah.
1 year, we're not doing it like a 3-year strategic plan?
Yeah, this is 5 years.
5 years? Okay. Next.
Okay, so then for the next 5 years,
You're allowed to update your plan annually, though. If you complete a goal,
We decided 1 was the most.
move it off and update it.
Oh, we haven't decided yet.
But we're not required to do another community health assessment for 5 years.
so what this is trying to do is to help align our thinking on a longer-term basis, not just on the CCO metrics, but things that will impact Lake County. All right, so that's what you want to keep in your mind's eye when you're marking 3, 2, and 1.
And 3 is what we consider most important.
Yes.
3 is the most important, 2 is the second most important, and 1 is the, so of the 7, there's going to be 4 that are not going to get weighted. So if you think obesity is not that important, don't put a number next to it. But if you think mental health is the highest important, that's where you would put a 3, or however you want to define it. And this is based on your understanding, your thinking, and we'll review this each year as a reminder, saying, are we still on track? Has it changed? I, for one, was very pleasantly surprised when I looked at the ranking of Lake County on how well we are doing. And you can go to the website, I'd be happy to ensure everyone can see, but it tracks from 2011 to 2018 how well we are doing on metrics. Now, it's not perfectly good data, but it's pretty good data. State does its own, but this is on a national basis. And I'm very, very pleased to say that in 2018, we were not second to the worst. In fact, of the 36 counties, we were now 29. We've made a lot of headway in some areas, not all areas. So, and everyone can look at it and look for yourself and see where we are having, as a county, more trouble than in other areas. Harney is still better than us, but Klamath County still worse. I'm just kidding. Just want you to all feel good about Lake County. So as you're filling out and marking those numbers, you've got to do.
So we take 2 minutes to mark the numbers and...
The question that I had was under substance use. So we have a little bit of data about smokeless tobacco for adults. Will we be able to, if we really focus on that, will that smokeless tobacco and youth be something that can be focused on during that?
Yeah, once you get the big heading, then our vendors got to start organizing people who want to be on that, and then you can pick your strategies from within the, from any of those things in substance use.
These are just the principal areas we want to begin targeting our work.
Paul, I have a-
Brooke has a
Do you
question.
know where the, under the social determinants of health, the food?
Right.
The 43.6% of children are eligible?
Yeah, that's Department of Education data.
For the whole county, that's
For the whole
about right,
county.
yeah.
Certain schools are higher, but
I wonder if we can count the county as one. I'm just thinking.
It's done specific, to get the free lunches, it's done
Yeah.
specifically by school, not by county data.
And
Or
Is
some
that
other
correct,
districts.
Will?
Yeah, it is.
Paisley drags us down a little bit, the whole county, because of the charter school and, well, actually Paisley in general doesn't have school lunch, for the three-period school lunch, so. Sorry, I'm thinking of immunizations, that's where they drag us down. Based on homeschool kids. Anyway.
well, and then if people didn't join us from Lake. I mean, what's not on here is that, you know, they do the backpack program,
Right,
you know, to make sure the kids are eating over weekends.
right.
In Paisley?
No, in Christmas Valley.
Yeah,
North
Christmas Valley,
Lake.
one purchase does, and someone's looking at it here, right? Brooke?
Yeah. I was thinking.
We're just gonna turn these into you, Art Vendor, or you want people to say what they did and you can just tally up?
Why don't we turn them into our vendor after the meeting?
Okay.
So that doesn't create any anxiety because someone doesn't want to copy the other person. I'm not pointing fingers.
Yeah, and you can leave the packet on the table and I can collect it after the meeting. Paul, after this, should we also share the new progress incentive measure progress?
Sure, if you want to pull it up, but we just got it yesterday, so things aren't changing too much, you know, because just as a reminder, an organization has 90 days to submit a claim. So it's not going to be till the end of this month that we're done with 2008. So if you got a service December 31st of 2018, you got 90 days. So some claims are still coming in, a little slower than others. You have Lake up. That's the EOCCO as a whole.
You want me to pull up the Lake County?
Yeah, might as well.
And that's also in the packet for everyone.
Did you notice that alphabetically Lake is right behind Harney?
Score-wise is what we can adjust. Alphabet we can't.
Okay. So, as Christy was mentioning earlier, I mean, there's just a couple people, really, I mean, to meet some of those measures, small numbers. The biggest one is the developmental screening. I'm not sure why we're kind of, you know, staying the same there over some 2017 to 2018 when there was concerted effort from public health and the primary care to make sure that after the kids got the developmental screen, they were having it reviewed by a primary care clinician.
We did,
And the Early Learning Hub was involved. You know, we got the ASQ tools and trainings down here. I'm not sure what's going on.
we actually just recently found in a review of those 12 additional ASQs that were used that weren't dropped in the claims. So revised claims will be going out, so
Okay.
I believe there was 12.
But
That we're not documenting properly?
Well, they were documented, but the code didn't make it onto the claim. So we'll submit a corrected claim, which should count us towards that.
yeah,
So,
we'd still be 7 down though.
yeah, we're still 7 down, but we're identifying, like we did, it was exciting that we actually got the providers to use the tools. And so now we just need to align their documentation practices, and hopefully that will be less of a struggle next year.
Can we look at those 19 claims and see if it's possibly we're missing out in other areas of the county, not just our clinic, whether, say, maybe it's up in North Lake, that we could do some more focused attention?
Well,
Say North Lake Clinic?
yeah,
Because this is entirely county.
obviously, you know, Charlie, that, I mean, this is the entire county, right?
Yes.
But each clinic has an incentive to do their own work, because you get paid separately for the quality pool. So that hopefully Christmas Valley is actually looking at it, or they could be losing money because of it. You could have met this measure, but they're the ones that might be pulling you down, right?
I understand.
Okay.
And it might well be that our percentage of their patient population is much smaller than, say, the CCO from the Bend area that are coming to see them up at Lapine Clinic. So they may not be as focused as we are.
Oh.
Hard to tell. So the...
But there's no incentive for, other than this is the data we share with the community, and you're going to get the LCAC funds based on whether EOCCO as a whole makes the measure.
So in the childhood immunization status, we missed on 2 patients.
Yep.
And they probably were not for measles.
No, they actually, both kiddos got their immunizations, but it was after they turned 2. So the good news is our kiddos got immunized. The bad news is we didn't get them in time, and they were from out of Lakeview. So it was, but now that we figured out why that occurred, and we know how to read the reporting better, and I think we'll be better moving forward.
Help me understand, the SBIRT down there shows on 2018 the target rate, 12%,
Yes.
and we did 38%, 38.9.
That was in 2017.
Over here to the right,
2018.
2018.
Yeah, at 2018, you did 36 of those screenings for adolescents. Yeah, so am I.
And SBIRT screening.
The 2 bottom
Oh, I
ones.
see.
Yeah, the third one up says 38.9%.
Okay.
That's how
And
many we did.
what's the target rate for 2018?
You have to have done 12% to meet. So we've exceeded.
And the previous
Target rate was
2017 was what?
probably about 2%.
Oh,
more
okay,
than that.
now I'm reading, now I understand. Okay,
Okay.
gotcha.
Yeah, SBIRT is back. Last year it was off, it wasn't a clinical measure, and now it's back as a clinical measure, not a claims-based one. And then the other new measure is if you have a diabetic patient, they need to have a dental visit during the year. So we have 19 incentive measures now.
The ED utilization, that's the first time we've met that.
Yep, and it looks like we're going to meet it across the region too, for the first time.
Yeah, I think, I was talking with Paul before we started, I think that we will meet colorectal because the chart-based, that's partially, it's chart and claim-based, and so once they enter our chart-based data, I believe we will meet that as a county between us and Dr. Graham's office.
Yeah, they bumped ours, we met ours now, so I went back.
Okay,
Yeah.
so yeah, that should,
They changed ours and we met, hi there.
so we're still optimistic that that one will meet.
We just have to hit more. Because we get this so close.
Yep, and then they're going to raise the bar a little bit upon the issue, right?
Those developmental screenings, that's what killed us.
Yeah,
They
we
upped
haven't
it.
we haven't got the new targets yet. Those come after they close. Yeah, somewhere in there.
Does the dental screening for all people with diabetics, all diabetics have to have a dental visit? Is
Yes.
that correct? Does it have to be a dental visit with a
Yes.
dentist?
Yes.
That's a
The
billable.
advanced practice hygienists are not eligible for those codes.
So you have a plan for some of
Don't know how we're gonna do
the
that.
remote areas that don't have dentists in their location?
Actually, that's something that we can talk with Mary Ann Wren about. I mean, they may need to just rent a dentist and send them around to,
I
you
know.
know, because they do have, in Gillum and Sherman counties, they got $50,000 from the EOCCO to do teledentistry with the advanced practice hygienist. So
But
once
doesn't
that software is in place, they can just kind of move around with that stuff and.
But if you said an advanced dental practitioner is not qualified to do.
True, but the equipment is there so that if you just had a mobile dentist, they wouldn't need much more to do the exam. They'd have to schedule like the visit and extraction and that kind of stuff, so if there were problems. But we could probably ask Mary Ann what they're, and don't forget, Advantage Dental is not really Advantage Dental anymore. It's
Right.
Advantage Dental DentaQuest, and then next year it'll just be DentaQuest.
No more app.
No, change the logo, went blue on us.
That's really an important thing for us to be thinking about, because right now, we don't have a dentist in Lake County that sees the CCO members.
Is it April 1st? No?
Is it April 1st that
I
they'll be
believe so,
here?
I heard that. just a couple
Okay,
days ago.
that's news to me, so
Yeah.
that's good news.
I think it's April 1st.
Okay. I don't have to worry about it. That's 2 weeks away.
Yeah, we've heard that before.
Right.
That was all I had, Susan.
Okay, perfect. Let's move over to the EOL updates.
I don't have any updates to give other than that the mental health first aid class went great. That's it. That's all I got.
What does great mean?
We had 11 participants, and it was just a really good mix of people from different professions, different backgrounds, so lots of good discussion, and hopefully we'll be able to do more in the future.
Was that held in North Lake or here?
No, it was in Lakeview.
It was in Lakeview? Because you did one in North Lake too,
We did one
also
in North Lake in November.
in November. Excellent.
You know, I saw the summary report, the annual report. That was very nicely done.
Thank you.
And it got published in OHSU's Office of Rural Health e-newsletter too. Did you see
Oh,
that?
cool. I didn't, I actually, I need
It's a paragraph
to,
with a link to the whole
I
thing.
need to go around
so-
and check who all published it.
Yeah, it was very nicely done.
Alana, I had a question. Are there any plans for having the normal mental health first aid classes for adults
If
in Lake County?
someone wants to say, hey, we want that again, then yeah, absolutely, we can talk about scheduling one.
Okay, we want that again.
And the older adult one?
Yeah.
We could try to do another older adult one. The last older adult one I did here, I only had 4 people show up. So I would definitely need to make sure that people are signing up for it.
What's
Yeah,
the critical mass for it?
At least 10,
Okay.
ideally 15 to 20.
So we, for our collaborative, if we worked and actually got, say, 15 signed up, said yes, they'll come.
Yeah,
Okay.
absolutely.
And I and Commissioner Williams were discussing about the mental health classes, and we felt there was a need for the law enforcement.
So all of our, well, not all, but we did 2 law enforcement mental health first aid classes last January.
Okay.
We could absolutely do another regular adult or youth for law enforcement. If they're open to it and they're willing to send people to it, I can absolutely teach it.
How long is the class?
8 hours.
It's all day. It's pretty good.
I actually went on a ride along with Daniel Tague last night. I didn't get back till about 1 a.m., so if I'm yawning, it's because I'm exhausted. But we talked a lot about that, and I think there's some, it's needed to do more trainings in the future. We want to do more trainings. Right now, it's hard to take an 8-hour day out of these guys' schedule. So hopefully looking forward, if we can get these guys a little bit more help, we'll be able to do that.
And I can split it. I can do 2 4-hour days. That's easier. As long as they're done within 2 weeks of each other, I can split it up into shorter days because I know taking that much time is an issue.
So I know that the report or something similar associated with it said that there's resources to do at least one more under that program for EOHLA in each county.
Yep, that's our goal right now, is to provide at least 1 per county this calendar year.
Okay.
However, we are actively searching for additional funding
To do more.
provide more than that.
Okay, originally, part of the funding was to help schools pay for substitute teachers or have proxies for law enforcement so that some of the funds went to take them off the street while somebody else served their role. Is there any of that money left?
Yep.
Yeah,
Okay.
it's partly that we don't have anyone else to serve their role.
We don't have any service right now.
If we take them off the street, there's got to be a body there. The guys are working as many hours as they can possibly put in.
Okay.
So we'll, if we get a few more bodies on the ground, not to get political, but looking forward with working with the town, if we can get a few more guys out there, it frees these guys up and we can actually schedule they actually will be available for more trainings.
What about other first responders? Because
Yeah.
while police officers are a good part of that, but we have the volunteer fire, all the fire departments, all of the search and rescue, all of the ambulance crews. There's a lot of first responders throughout our county that could really benefit from this.
Yeah, I mean, if they're willing to attend, I'm willing to teach. There are specific modules for EMTs and for firefighters. I'm not certified to do either one of those. I do teach the law enforcement module, but if there was interest, that is something I could talk to John about getting certified to teach those modules, because it would be a little bit more beneficial, I think, for them to go through the specific module that deals with more so their unique experiences. But absolutely, let's get them on the calendar.
If you could find out what it would take to become certified, I think one of the things, since they're all volunteers, they touch lots and lots of parts of our community, and that would really enhance having that service more readily available throughout the county in lots of different places. So we could try to contact the different fire departments and ambulance or first responder organizations saying.
And we have RFPAs on the north end of the county. There's over 50 volunteers on those groups with multiple vehicles and everything. The more training that we can provide those guys, the better. We've got a lot of young people that are actually stepping up, surprisingly enough.
What's that acronym?
RFPA. It's a rural fire protection agency.
Oh,
and it's all volunteer. We've got a bunch of Humvees and different things, and it's basically just all the ranchers and we go through multiple fire training and everything, but a lot of these young people, they don't know this is necessarily what they want to do, but by providing training to their group, it's a good learning experience all around, and it educates the community.
There is a fire chiefs meeting once a month, so that might be something to get you on the agenda, or at least get some training material or some information out to them. I can find out when that is, but it's usually held in Paisley. So I think a lot of times those first responders are getting there before law enforcement sometimes, and so I think that training would be really valuable for them.
Do they end up doing CIT, or crisis intervention training for first responders, law enforcement in this county?
I don't know the answer to that. I have not experienced that.
I just know that other counties I'm involved in, and usually annually or every couple times a year, I end up being involved with one of the presenters at those trainings.
I mean, I know the state troopers go to CIT. I don't know about our city or county guys.
I haven't seen one that's combined for all of the agencies. I mean, like I know within fire, we do the different, if you're first on scene, how do you facilitate the scene until things get moved forward, but I haven't seen one that is an entire public safety for our county.
And I'll speak with Commissioner Williams and let you know how soon we can plan a training for the law enforcement.
I'll talk to the other guys and the other groups in the RFPA. I'm on the ops group for the RFPAs, so I'll talk to them and see what their ideas are and providing a little bit more training to the groups.
Yeah, absolutely.
It's all volunteers, so we're struggling to get our guys trained up to a good point.
I'll give you one of my cards before the end of the
Excellent,
meeting.
that'd be wonderful, thank you.
Give me that.
Okay, we can move on to chip updates.
Thank you, Susan. So I'll start with the Living Well classes. We got done with the Living Well with County Conditions class in February. And so our Living Well facilitators have been really busy in 2019. We had the diabetes class in January, chronic conditions in February, and we're going to start the next round of diabetes classes in mid-April. And also we are going to relaunch the diabetes support group. We had started that briefly last year. but then our facilitator, she had some health issues, so she wasn't coming to hospital, and now we have a new person. We have Erin Stewart, and can you pass this around? So we'll be having these diabetes support group classes. They're going to be once every 3 weeks. So that's good news, because we didn't know if we were going to be able to conduct the support group classes again, but we can now.
Or just remind me, was that LCAP dollars that supported that originally, or was it a partnership with the people from Klamath?
I think it was LCAC dollars.
The support group specifically, is that what you're?
Well,
Yeah.
just the bigger program.
It was we got what, maybe $1,500 from that group out of Klamath.
Oh, okay.
But most of the funding
Most
was
of it was
through
LCAC
the,
funds.
yeah, the opt-in grant, the Population Health Management grant last year.
Okay.
And also the chronic diseases and the diabetes living well classes were from the LCAC funds. Yeah.
Question though, so cooking demonstrations, is it, like, people are getting food too?
Yes, so Erin will be teaching them how to give them healthy cooking options, and they're gonna all cook together. So that's the plan.
You should go over, have you met Erin yet?
No.
You need to go meet
She
Erin.
new?
She's newly back. Erin is from our community originally, but she's joined us back as a PA.
That's awesome.
And she's really, really excited about this, and I think she would love to partner.
Christy and I were just looking at a program that was called Prescription Kitchen. It's something that it was covered under insurance, and people could come to cooking classes. But then it's something like those services.
And you and Erin share the fascination for hummus. She's also big.
Great friends.
Hey, Brooke, can you say the name of that program again?
Yeah, Prescription Kitchen. It's from Medford. We're doing it at the hospital there.
And you're saying that insurance will pay for this?
Yeah, because it was through OHP.
Okay.
Yeah.
It's an established program.
So I think there's a copay with it. Yes, it is.
It's not OHP then.
Yeah, it can't
Oh,
be.
really?
You can't charge them any money if it's
There's no
OHP.
copay
So then
for
maybe- so they
deductibles for OHP.
I mean, today was the first day I looked into this.
I'll look it up, but
Yeah.
I'm thinking as a region, we're doing food. That's one of the things that the regional CAC picked
Uh-huh.
for its priorities, and I'm trying to say, okay, what can we do? That sounds like something.
I'll send you
Yeah.
the link that I sent to Brooke, which I still haven't read.
It
What's
seems really
that?
cool.
I had sent her the link to it, so,
Oh,
and
okay.
I'll send it to you too.
Thank you.
Our next update, there is going to be a learning fair event at the North Lake School on March 20th. So the learning fair is going to be from 4 to 6 p.m. So there's going to be staff from the Lapine Health Center who will be scheduling adolescent WellCare appointments with their providers. And the clinics will follow their processes and procedures to bill EOCC or private insurances for the visits. And we'll also have a reproductive health table from the Public Health Department. And we'll be sharing information about the services available at Public Health. And there are going to be flyers and facts that we shared about contraception, sexually transmitted infections, and more related to that. And we'll finally also be having our CHIP department table over there to give them information of all the amazing programs we offer. And this will also include applications for the next Food Co service member. And that's kind of a segue I had planned to my next update. That so this year we were planning to recruit someone locally for the Food Co service member position. And we will start advertising soon and start holding interviews. Fingers crossed about that. Otherwise, we'll go back to the candidates Food Co provides us.
What's it called, a learning fair?
Yes. It's a community learning fair or community learning lab. That's what they're calling it.
This was our compromise, so having the teen health fair in October,
Okay.
right, didn't work because up in Lapine, they laid down the law, the providers did, and they were only doing the AWCs and not doing sports physicals.
Right.
So we wanted, we can't do another one in the same school year. So this was the compromise, was to do something in the spring before all the kids would need their physicals.
Okay,
Blessed by EOCCR. Blessed,
okay.
we're good.
A school learning fair, I'm thinking, I think the purpose of schools is to learn, but
They're tricking them.
Put fair on the end, they're gonna get
Yeah.
these.
Yeah.
I think it's a fancy fair with an E at the end too,
Oh,
so yeah.
yeah, Renaissance.
Yeah.
And it's aimed at students and their parents together.
Oh, okay.
That's the trick usually. You need a family involvement event
Yeah.
in order to get parents need more education than kids do.
Good.
That sounds good.
So the next update is, I just want to remind the committee again about the summer lunch program. So again, since 2017, we have been conducting the summer lunch program in Lakeview, and this will be the third year for the food program. Again, the summer lunch program provides free lunches to students up to the age of 21. Well, for the first 45 minutes of the service, we are pretty strict about it, and we hand it only to students or children, and then the last 15 minutes we hand out lunches to everyone, depending on if we still have lunches and haven't ran out of them.
When will that start?
June, I don't know the date.
The Monday after
School's out
School's out on June 9th.
June 9th,
June-
so it'll start the next day?
June 10th is the Monday. Yeah.
Do you also have the date when it ends?
Yeah, and then we'll wrap up the Friday before Fair Week, which is August 23rd.
So the 10th is Monday? Okay, and then it would be the 7th then.
So what happens between 23rd fair and school starting?
We struggled, we had a planning meeting in February. That was the one that we two weren't able to make. Talking about continuing it, we did that last year, ran the program through the Wednesday of Fair Week, and attendance it would just dropped off by that. I mean, August, there's a drop anyway, you just get fewer kiddos that month, but it was so low at that point, the team decided that not to continue and offer it that. So there will be a few days before school starts.
Does that pose a problem, do you think, Will, with the week where kids have been coming and getting lunches?
I don't think it should, no. I think that would be fine. I don't see a conflict there.
No, I was just thinking in terms of the health of the kids, and when they come into school,
Yeah.
they're all excited about school anyway.
Yeah,
But you want them as charged up as you can.
Right.
yeah.
And I wanted to again brag about the numbers that we have been doing so far for the summer lunch. So in 2017, we served north of 2,000 lunches, and in 2018, we ended up serving close to 5,100 complete lunches. And we hope to do even better for 2019. So there has been a huge community buy-in for the program. For both the years, we had many weeks which were volunteered by community and health partners. And again, so I just wanted to again remind the committee and just spread the word that we are again looking for volunteers and also filling up the weeks of the summer lunch program. And so that we just started discussion with our agencies, and very soon I'll be hounding all of you and finding out who all the volunteers will be.
Can I tell them about a couple of changes that we're looking at that we haven't finalized yet? The team decided to do just 2 sites in Lakeview this year. So we'll be at the kiddie park, that's the given. And we'll be at the north end at the Commons again. And we decided to scrap the pool park. We had, I don't know, probably 10, maybe an average of 10 kids a day, which is nothing to sneeze at. But they weren't necessarily the kids we're trying to reach with this food program. And the decision was made that we should put our efforts into doing the 2 other sites as well as we possibly can. We're also in talks trying to figure out whether we can serve in Christmas Valley. We have a couple of different options. One is to partner with the library. Their children's librarian goes up once a week to do the summer reading program. That may not happen this year unless they partner with us, because last year they had grant dollars that covered his mileage, and this year they don't. So we could get the mileage paid for with the summer lunch program if David were to haul our lunches up there. The logistics of that, he leaves Lakeview at 8, so we'd have to have the cooler packed with the lunches and the milk before he left. He stops in Paisley first, and he doesn't get to North Lake until 2. So that's kind of potentially problematic. Peggy Watson is the new Kathy Pike at the clinic. I can't think of what her official title is. But anyway, she's our new outreach person at the Christmas Valley Clinic. She is also a school bus driver, so she's got all kinds of connections. And she is talking with the church there, the big church whose name escapes me, because they do all kinds of camps and things for kids throughout the summer. And so she's going to talk to them and see if they're interested in possibly being involved with the lunch program. She's also going to talk to the school and see if they have summer school or anything that they might want something. If that happens, then we told them that we'll need Christmas Valley. We'll need to actually build the lunches. It just that's ideal anyway if we could somehow get them preparing their own meals, because hauling something up from Lakeview is just it's not practical. So.
Chris, you say her name again?
Peggy Watson.
And, I mean, Peggy, or Kathy's always been on the phone. Is she gone from the clinic or a different
Kathy
role?
is there.
Yeah,
Okay.
Peggy is the new Kathy.
Peggy,
Watson.
Yeah.
thank you. We should invite her, or Linda.
For the, yeah.
Peggy, get her on the list.
And we have a couple more planning meetings left, so probably, hopefully, we'll have a way to serve on in North Lake.
Yeah.
I noticed last year on the radio, you started off saying they were going to be in New Pine Creek, and then that wasn't on the radio anymore. Did nobody just show up?
Oh, I have a nice story about that. So we had the New Pine Creek site. We were active for 2 to 3 weeks. So we didn't see a big turnout, but that was not the reason. But then we came across one parent who gave a hard time to our volunteers over there.
That's a nice way of saying it.
And so we had instances, and that also involved me one of the days. So our volunteers showed up barely like 5 minutes late, and she scolded them. And when I was there, she again complained to me that, that we weren't doing the program to the best. Yeah, and so because of that, we had meetings with our team, and we decided to,
Did you explain to her rush hour in New Pine Creek, maybe 5 minutes?
I think we all...
It was weather related. Something happened. That's why they were late that day.
It rained that second week of the program.
Yeah, I think it was truly weather related.
Do you think?
I just really don't know. I was just curious about why the change. But most people in New Pine Creek, that's where I live, travel into Lakeview daily anyway. And so, they can put their kids in the car and bring them to lunch. I don't see that there would be that huge of a demand. And if they want to come to Lakeview, they always find a way to get here. So.
There were families from New Pine Creek at the Kitty Park last year, so, yeah.
I would imagine. Like I said, they mostly, seems like people come in every day for something.
I would turn around and say, well, it sounds like you have a lot of interest in this program. Would you like to help volunteer?
Really? Help whip us into shape.
Yeah, and we did tell her that this is a volunteer-based program, and so now I remember. So we were taking 3 lunches every day because we had 3 kids who were showing up regularly, and so one of the days I think so the same lady, she brought 6 kids, and the system we have is when we need more lunches, we call the kitchen and ourselves go and get it. So again, she wasn't too happy that we did not have more than 3 lunches. And yeah, and we had a lot of volunteers from hospital who were volunteering, and she was giving them a hard time, and yeah, which was...
That's unfortunate.
Yeah, there I would think probably a mental health issue there because it's not unusual.
Yeah. We'll invite her for the next mental health first aid classes. So the next update is about the supportive housing meetings we have been having quite a bit. I still haven't been able to wrap my head around all the information that we have, and information keeps changing every 2 weeks for the housing for homeless people. I think Christy will do a much better job with the update, and I promise I will take the reins from you very soon, Christy.
Well, we're hoping that's the first update, is that one of the things we need to do pretty much right away is get somebody in here who knows housing, knows supportive housing, and can help us navigate this, because I hope I'm not speaking out of turn, but none of us are housing experts. And we do really need someone in here who can help us put that together. So I know that there is a foundation in Oregon that has a housing portfolio that does have some technical assistance dollars available that could help us get a project director in here. I don't think it opens until this fall, but I'll be having that conversation with Meyer Memorial Trust just to start talking through that process. So our vendor mentioned information changing, and it's not so much that, it's just that we're learning all the time and we have more things on the table. So permanent supportive housing is what we've been talking about for the longest period of time. The idea of having people with mental health, substance abuse, legal, child welfare, all those kinds of issues together, give them a permanent place to live. And again, originally we looked at the idea of temporary housing, but then we run into the, okay, you're at the end of your 6 months, 1 year here, where the heck do you go next? So we started looking at permanent models, started doing research into how we should set those models up. Housing first is the big, and you called it a buzzword, of the federal and state levels right now. And the idea behind housing first is that it's a very low barrier housing. You don't require people to be enrolled, to be set up with a counselor, to be part of getting help for your substance use issue. They don't have to do anything but to live there. And that sounds insane, but there are actually some really good statistics out there that support that particular model. And that is where the funding is at, frankly. If you're looking at permanent supportive housing, then people want to see that you're using this housing first model. The other model we're looking at is, I don't remember, there's a word for it, but basically where in order to live here, you have to be enrolled in counseling, you have to be going to job skills classes, you have to be doing certain things in order to qualify there. We had a conversation at the last housing meeting on Tuesday that really those two models serve two different populations. And so we need to decide if we want to help the people who are easier to help because it's going to make us look better when they're successful, because they're going to be easier to help them succeed. Or do we want to help these folks who have no chance of improving unless they have that stable housing? So that was something that was discussed. Commissioner brought some good information about a facility in Pendleton. They do detox there. It's a residential facility, and honestly, I left that meeting thinking maybe that's the more pressing need for now, and that's kind of the situation, as you guys know, for housing, is that everything is a pressing need, and it's just figuring out what's the most logical place to start. A couple of guys from Oregon Housing and Community Services were in town yesterday. Was that just yesterday? And our vendor was at that meeting. The commissioner is at the commissioner's office. Charlie Pike was there from the Veterans Association, and they filled us in on some good funding opportunities, had some really good ideas about next steps we can take, and so that'll be a really good.
Was it Kenny LaPointe?
No.
It was Gus Bidwell and
Connor
Connor McDonald. Yeah.
From the,
So,
the-
Oregon Housing
Yeah.
and Community
Yeah.
Services.
And they were filling us in with